What's up, guys? Happy almost 2024. I hope you guys are doing well. Uh, Welcome back to the Dude Nurse Show. This episode comes from some personal experiences that I've had over the last month or so. I was called to come to Oregon to help with a hospital closing. That's right, a hospital closing in Eugene, Oregon. Now, Eugene is the second largest city in Oregon, behind Portland, and it doesn't have a hospital anymore. You heard that right. There's no hospital. There's no emergency room. There's no surgery. There's no inpatient stays. Nothing. It's gone, closed, finito. This was by and large due to financial reasons. There are some speculations as to how much the system lost just this particular hospital. It's been in Eugene, I think, since the 1930s, so almost 100 years. That may not be correct, but it's been here a long time. So, and now you have to go to the next town over, which is Springfield. It's super close, but that's not the point. I mean, the city doesn't have a hospital. So most of that, like I said, were due to financial reasons. And in this episode, we're going to talk about some of the biggest factors that are facing healthcare systems, hospitals, etc. today and are expected and projected to continue to affect said healthcare systems. Um, Number one, and I know, a lot of you guys, this may not mean a whole lot to, but we're talking about reimbursement rates from CMS or the Center for Medicare and Medicaid Services. Let me just take a quick gander at my notes here. So, reimbursement rates have kind of steadily fallen, especially when you consider the last couple of years with inflation. Thanks a lot, Joe Biden. According to the American Hospital Association, hospitals in 2020 registered a negative 8.5% margin on Medicare services. And that is expected to continue to decrease. Now, I believe in 2021, um, there was a slight uptick in that, but that was only because the government paid out billions and billions in relief funds. Otherwise, the hospitals would have continued to tank. And these reimbursements have dropped anywhere from 1 to 2%. And when you consider the fact that, 50 to 60% of the services that are paid for at hospitals is paid for by either Medicare or Medicaid, and the fact that you can't negotiate with Medicare. There's no negotiation on the rates. Um, there's been a lot of talk recently or in recent years with like United Healthcare. I know Methodist Hospital in the area where my house is and in the Houston area, they were looking at potentially not taking United Healthcare due to them not, reimbursing enough. And some home healths and hospices have not decided to take United Healthcare because the reimbursements just aren't good enough. So, but we'll talk about commercial insurance on another episode. But basically, Medicare and Medicaid, the two largest payer sources to hospital systems across the United States, are continue to cut their rates. Um, Now, I don't believe that all of that is due to poor performance by the hospitals. Let me tell you what I mean. When a hospital, let's say for example, a patient checks into the hospital to have a knee surgery. not even an emergency surgery, just a knee replacement or something like that. So patient goes in, has the surgery, is in the hospital for a day, maybe two, and let's say that for whatever reason the patient develops a post-surgical or post-operative surgical infection. The hospital is paying for that. Insurance will not cover that because it's preventable. They look at it as if the doctors and the nurses had done their jobs properly, this infection could have been prevented. Um, Now, whether or not we agree with that, that's again a topic for another time. But that's the way it is. If a patient gets a bed sore or skin breakdown due to a bed sore, um, the hospital eats the cost of that, and we're talking thousands and thousands of dollars. If the patient has to go back in for a second surgery, it could be tens of thousands, maybe even 100,000. That the nurses are still going to get paid, the doctors are still going to get paid, et cetera, et cetera, but the hospital will not. Okay, so I'm not talking about that per se. I'm talking about reimbursement rates across the board. They have continued to to decline for these hospital systems. There's been quite a few hospital systems that have closed over the last few years. I don't have the exact numbers, but it's a staggering number. And as I said, I just came up here 3 weeks ago to help out with this particular hospital closing, and I can tell you it's really affecting the community in a very negative way. Most of the people I've talked to as I've been riding around the bus, walking, going into restaurants, taking Ubers, they had no idea that the hospital had even closed. Um, Now, I will say that, it was on the news, so, I don't feel totally sorry for all of these folks. You need to pay attention to what's going on in the world around you. So, um, read a newspaper, talk to a buddy, social media, however you get your news, you need to get it somehow. Because I've seen people showing up thinking that there's a hospital there, thinking that they're going to get emergency care, and all that's there is an urgent care. And urgent care is not the same as an emergency room. I'll talk about that in another episode. So these hospitals are making less money. They're losing millions and millions of dollars, and that's just not a sustainable model for any kind of a business. So, in addition to declining reimbursement rates, we're going to talk about the increasing cost of labor as well as the shortages, um, particularly nurses. As I'm a nurse myself, I can speak to this. There was a video recently from the United Nurses Union, I think it was. I may be saying that wrong, but I'll find it and leave it in the description below. Whereas the president, I don't know if she's a nurse or not. It wasn't listed in her credentials across the screen, but she basically said that there's no nursing shortage and said that there's a shortage if A or B, excuse me, exist. And then she went on to say that, well, we have B, but it's for this other reason. So she basically contradicted herself. Um, she was saying that, oh, we have, plenty of nurses. They're just leaving the field of nursing, or not as many are going into it. And that was the two. Either not as many are going into it, and or they're leaving. Well, nurses are leaving for several reasons, and I'll make a separate video on that as well. Why nurses are leaving, and why fewer are coming into the profession. And it's not all about money, although that's part of it. But one of the things, going back to money, um, due to less available qualified staff, nurses, doctors, speech therapists, occupational therapists, physical therapists. They're having Hospitals are having to rely on contracted staff and pay them double, triple, sometimes 10, in some cases 10 times as much. These really, really astronomical rates were very prevalent during the pandemic. I mean, I was working making 13 up to 13 grand a week at one point during the pandemic. Somebody had to take care of these patients, and it was very dangerous. And so, it's not really a surprise. But so because there's not enough qualified staff, like I said, they're having to go to staffing companies, and I can't tell y'all how every single day I get text messages, emails, phone calls from people that I've never spoken with, I've um, never even heard of, and they call me and they call me by name. They know my first name and they have my phone number, and I'm like, what the hell? Who are you people? How did you guys get my information? And they're like, yeah, we have hundreds and hundreds of contracts. I should start posting some of the emails from these places that I get in the text messages um, from these recruiters. I mean, they're like hyenas, they're jackals, they're like wolves, just chomping at the bit to get you. And as I said, the rates have gone down quite a bit, but it's still not terribly difficult to make $3,000 to $4,000 a week, um, doing some of these assignments, and that's really good money. So you know, and so if I'm making 4,000 a week, then the hospital's probably paying 5,000 a week because this recruiting company, I mean, they got to get their cut, right? So you know, like I said, the cost of labor has gone up significantly. And, because people, particularly with nursing, and nurses are the single largest provider of healthcare services. There are more nurses than any other profession in healthcare. So that's significant. That being said, you know, less nurses are also going into the field of academia to teach future generations of nurses. So it's kind of a double-edged sword. There's less qualified people to teach the new generation. There's also less people who are interested in the first place in going into nursing. But for the ones that are interested, they have long wait times. Say, oh, you've been waitlisted. If your grades aren't top top notch, you're not getting in. Um, and that's another issue. I mean, I've heard people talk about, well, why does it have to be so hard, and why do we the standards so high? I mean, do we want the standards lowered when it comes to people taking care of you in the ICU? I don't. I want the top notch. I want the best and the brightest, and that's what hospitals go after. Um, we can talk in another video about why uh, there's lots of turnover in healthcare, which that kind of goes back to why so many nurses are leaving. There's healthcare uh, has become more dangerous, in my opinion, for frontline healthcare workers. Um, the managerial spots as well. No, I mean, I've done that. I hated it. I was miserable, getting calls 24 hours a day, not not being free to go and do what you want when you're off because you got to be close to the phone. You might have to get called in. It's screw that. And you really don't make that much more money when you factor in how many hours you work. So that's a topic for another time. I apologize. I think I'm getting cold. Um, but, you know, all of these things are affecting your ability to go and get health care. And healthcare is a service, and the ability to obtain said service is decreasing. Um, sure, some new hospitals are being built, but when you consider the fact that it takes, you know, a year, maybe more, to finish a hospital, um, they're not being built as fast as they're closing. So, you know, one of the other things too is that, you know, with our the major crisis at the southern border in particular in my home state of Texas, it's estimated that we provide anywhere from 17 to 20 billion dollars annually of health care to illegal aliens. And I mean that's a staggering figure. You know, people uh, botched at the wall. And again, topic for another debate, but they didn't want to build the wall. Oh, it's going to cost 20 billion or 15 billion or whatever the hell they said it was. That's what we spend in 1 year of healthcare on these illegal aliens pouring into our country unchecked. And when they go to the ER, I've been an ER nurse basically my whole career. You know, we don't we don't ask for people's papers. We're not allowed. We can't even ask for their insurance card until they've been screened. Otherwise, it's a violation of what's called EMTALA, EMTALA, the Emergency Medical Treatment and Active Labor Act. But we don't ask people for birth certificates and all that kind of stuff. We only ask for insurance cards after they've been screened by or had a medical screening by either an MD, a DO, or in some cases an advanced practice provider, a nurse practitioner like myself, or a PA, physician assistant. So we're not ICE, you know. We don't. I mean, even nurses, we don't. The healthcare doctors don't. The nurses don't. The CNAs, we don't get involved in their insurance. We don't ask them ever if they have insurance. We're not allowed. It's a conflict of interest. I don't talk about a patient's insurance. If they even ask me a question about insurance, I say, you know what? I don't have a clue. You can ask registration. I'm just here to take care of you. I don't care what kind of insurance you have. I don't care if you can pay or not. Simple. So I just wanted to talk about this because it's something that's important. Our healthcare system is not perfect. Um, but we can definitely make it better. We need some additional policies and things, which, like I said, I'll talk about in another video when I allude to why nurses are leaving the profession or moving out of the profession or not coming into the profession. There's a lot to unpack there. So um, I hope you guys enjoyed this video. I hope you found it informative. Hit that thumbs up. Please consider liking and subscribing. Until next time, y'all stay well. Peace.